Alright, welcome back to Microbiology. You are the visually gifted, and today we are going to talk about Parvovirus B19. We're going to use this basic picture of a hole. This guy's shooting this hole with his club. He's got his nice erythrocyte ball. He's got his spotted shirt. He's blushing. The reason why he's blushing is because this is a Par19 hole, and it's a couple feet away, and he knows in his heart of hearts that it may just take him more than 19 strokes to make this hole. And if he has to, he'll pull out his sickle club in order to try and tap that erythrocyte right into that hole. I have this V in here, which I have on all my viral um, just have a quick association and know that this is something viral, and so we're not looking for bacterial cues like gram stain. So parvovirus B19, Par19. So when you hear parvovirus, you immediately think par, you think golf, and you think this picture. You're also going to think golfing with a long bone and a erythrocyte, which is going to represent a transient defect in erythropoiesis. So this is gonna have different sort of interesting consequences depending on the physiology of that individual that contracts this parvovirus. For example, if it is an infant, it will cause a hydrops fetalis potentially, which is when you have an anemia that leads to an overworked heart that is going to fail. The reason why the heart fails is because more strokes are required to keep the oxygen levels homeostatic, because for a given beat, the flux of red blood cells is going to be less because what is an anemia? It's a lack of red blood cells. So that overworked heart then fails because it becomes and then becomes congested. And the reason it becomes congested is so one side of the heart fails to begin with, and ahead of that pumping heart that's still pumping, that half the heart that's still pumping, there is a wall of blood because the other half of the heart is not clearing its circuit. And this is basically analogous to clamping a vessel or vein, and obviously that would cause an increase in hydrostatic pressure and hence a hydrops or edema. In the case of hydrops fetalis, it's an edema in more than one compartment. And I like to remember what hydrops means by picturing eye drops. And eye drops is a fluid that you put in your two eyeball sockets. And just like eye drops, hydrops is fluid in two compartments, just like eye drops in your two eyes. So I think that makes it fun and easy to remember. Notice this Par19 hole is a few feet away. That is a quick reminder that this is the smallest DNA virus. It is both small in that it is single-stranded, and just in terms of its capsid diameter or radius, it is small. You can also remember that by remembering parvo means small. It has the same etymological root as pauper, and if you know what a pauper is, it is someone having a small coin purse. So that's a way to remember it. Green wristband. You see he has a green wristband. I use green wristband in all my pictures to denote joint pain problems. Here it's an arthralgia or a joint pain. So arthralgia, of course, is joint pain. Joint pain. You see he has this spotted shirt that represents the exanthema, which is a general name for a widespread rash. And generally when people say exanthema, it's sort of implied that it's with kids because kids happen to get these septic rashes that are caused by the classic exanthema causing pathogens such as rubella or roseola or varicella and so on and so forth. Varicella, yeah, This infection also causes, or is also called erythema infectiosum, um, and the whole exanthema terminology can be contrasted with enanthema, which you may or may not hear, which is just basically the same rash except on a mucous membrane, such as in the mouth. Notice again up at the picture, he is blushing because he is not sure if it's going to take him more than 19 strokes to make this whole. Um, he has a slapped cheek. This is also called fist disease, so a parvoviral infection with exanthema and arthralgia and so on and so forth can also just be simply said, oh, this patient has fist disease. And you can easily remember that this is also fist disease by remembering the slapped cheeks, the embarrassed looking cheeks. And this is the only exanthema to be called by the 1st through 6th exanthema nomenclature, or whatever you want to call that. You may hear of first disease, second disease, third. No one actually really says those anymore. They only use fifths still, so it is still commonly called fifths. And I think the reason why this one is still called fifths is because of the maybe conscious or subconscious association people have made with fifths and the slapped cheeks or the malar rash. A 5-finger slap to the face is a slap, and so people were probably just calling that fifths more often, and so it stuck more often. That's my theory. I don't really know too much about how that actually went down, but it's an easy way to remember this. You see the sickle. This just to remind us that for sickle cell anemics, you're gonna have a special case. Maybe this argument with the transient defect in erythropoiesis is enough to help you remember that sickle cell anemics are also gonna have a problem. The reason why it's going to be a special problem for them is they already have a very strong dependency on hematopoiesis because there's a reduced lifespan of their sickle cell red blood cells, and this is going to cause a particularly serious problem in sickle cell anemics called the aplastic crisis. So yeah, that's the picture. I have one last question to maybe assess what we know and how we can apply it. So a pregnant woman comes to you with a malar rash, as if she's embarrassed because she just took 20 strokes for a par 19 hole 250 away. You're definitely worried. You are definitely worried about the symptoms or this symptom because diagnostic testing is contradicted because there is no effective treatment nor vaccine for parvovirus. Specifically, what fetal condition is on your mind? And this whole contradicted testing with the potential of being diagnosed with parvovirus is only contradicted, I guess, would be for some people would maybe suggest that. And the reason is because even if you are diagnosed with it, there's nothing you can really do about it as far as I've researched, and so that can just increase anxiety and fear in the pregnant mother, which of course with no benefit is something you wouldn't want to do. But what is the fetal condition that comes to mind when you think of this? Obviously, it's what we talked about. It is hydros fetalis. It is, and how do we make that association? The anemia, of course, is a good indicator. We have to understand hydros fetalis, which is not included in this visual, but I think it is logical enough. But remember, hydros fetalis was just a fancy term for multi-compartment edema in the fetus caused by anemia and subsequent heart failure. Eye drops, remember, go in 2 compartments, just like hydrops is in 2 or more compartments. But remember, malar rash doesn't guarantee parvovirus, so keep your worries differential. That's all I have for this one. Thank you for watching. This was parvovirus. Please subscribe to Microbiology and have a good study. Have a good day. Cheers, guys.